Bismillahirrahmanirrahim. Our today lecture is related with blood. Our learning objective of this lecture are what is blood, composition of blood, and function of blood. We will discuss these three objectives in this lecture. What is blood? This is the most commonly asked question from the student, that what is blood? Blood is a dynamic, life-sustaining solution in animals with closed circulatory system. Dynamic and closed circulatory system. The system is between the heart, the lung, and the blood. We circulate between the heart, lungs, and vessel, and it does not go outside this system except when there is injury or inflammation. Otherwise, it circulates between the heart, lung, and in the vessel. The heart receives the deoxygenated blood from whole body, and then the heart pumps this blood into the lungs. In the lung, blood is oxygenated and it is drained into the left side of the heart, and the left side of the heart pumps it to the general circulation, and then this blood circulates in the arteries all over the body and deliver this oxygen to the extracellular fluid, which is called the internal environment of the body. The oxygen is delivered to the extracellular fluid or internal environment of the body, and carbon dioxide is added to the blood from this extracellular fluid, and then it is bring to the heart again, the right side pump, and for oxygenated pump into the lung, and this cycle continue throughout the life. What are the compositions of blood? The first composition of blood: ions, nutrient, waste products, and hormone and other substances like gases and metabolic products. The second composition of blood is cell. These cells are blood cells which are called RBC, WBC, and platelets. RBC stand for red blood cell and WBC stand for white blood cell, and platelets are different type of cell. And the third composition of blood is plasma. Most important properties of blood. When we are talking about the color of blood, it is bright red in artery and dark red in veins. Why it is bright red in artery? Because it is oxygenated. When it gains oxygen from the lung, its color is bright red or scarlet. And in artery, when the blood deliver or the RBC deliver oxygen to the tissue or extracellular fluid, it becomes dark when it added carbon dioxide to hemoglobin in the RBC. You can see your vein on the surface of your body. These veins look blue. It is due to the presence of deoxygenated blood in these veins. Mass. If a person is 70 kg body weight, 8% of the weight will be of the blood and 92% weight will be of other tissue. Its pH is slightly alkaline. It is 7.35 to 7.45, and it is a very narrow limit. Any changes in this limit leads to serious consequences. Taste is salty. Temperature is 38 degrees centigrade or 100 degree Fahrenheit. Normally the body temperature is 37, but because the blood flow in the vessel due to resistance or friction in the vessel, it is a bit hot than the body temperature. Viscosity, we know the viscosity of water is 1, so it is 3 to 4 times more viscous than water, and its volume is 5 to 6 liter. What is basic facts about? It is fluid in nature. The color is red. Total circulatory volume is about 8% of body weight, 5 to 6 liter in 70 kg male, 4 to 5 liter in normal female, and 5 to 6 liter in normal men. About 55% of this volume is plasma. Percentage is 55% and 45% are composed of cell. It is connective tissue in nature. Speak of blood. When we are talking about blood, we use 1 cubic millimeter. 1 cubic millimeter is equal to this much blood, this a single drop of blood, and this single drop of blood contain 5 million RBCs, 3 lakh platelets, and 7,000 white blood cells. Blood is the most commonly used part of the body for laboratory investigation. We use blood for laboratory purposes for investigation. We use the blood for screening purpose, for diagnosis of the disease, and for prognosis of the disease. In hospital, when we do screening of a patient, it is before operation. Before operation, we do the viral profile, the blood sugar level, urea, creatinine, and also sodium potassium chloride level, because we want to know about the status of any viral disease that a person is suffering from it, or he is free of viral diseases, or if he has diabetic, so he need control before operation, and if there is a renal problem, the body electrolytes imbalance or urea creatinine imbalance may be reported. This is very important before the operation, that a patient may be screened for all these conditions. Diagnosis: when a patient is admitted to the hospital, we send the blood sample for diagnostic purposes, and through various tests we can diagnose a patient. For prognosis of disease, it means that when the patient is admitted, after medication, his tests are compared with the initial test, and the concerned doctor then assess patient is improving or his disease need further medication. Why we use blood for laboratory purposes? Because it is easily accessible. It is invasive procedure, but it can be performed easily. How? When you put the needle into a vein of a person, you are just in the stream of the person's blood. This is easy procedure, and with a little practice you can make a person skilled in this procedure. This procedure can be performed easily comparing to the biopsy or bone marrow aspiration. This is very easy procedure. Easily obtainable. When you put the needle into the vein and just pull the plunger of the syringe, you get the blood. We can obtain the blood very easily. Easily testable. We can do a test on blood very easily. We can do the test manually. When you will go to your laboratory in college, you do a hemoglobin test, ESR. These tests are performed manually. So you can do manual tests on the blood. And you can also assess the patient condition by looking on centrifuge blood. When you centrifuge the blood and just have a glance on the centrifuge test tube having the centrifuge blood, you can assess the patient condition from the plasma. If it is yellow, you can easily say that this patient is jaundice, although it does not give us the actual value, but we can just assess that this patient is suffering from jaundice. And also, if the plasma is so viscous, you can say that the person is suffering from hyperlipidemia or his lipid has high profile. We also do test blood by machine. Very advanced machines are now available, and these machines give results in minutes. Blood is truly river of life. Why it is river of life? Because it reaches to every cell of the body and irrigate it and remove the waste product from each and every living tissue of the body. If we take some blood, prevent it from clotting, and take the blood in a test tube, first in a syringe, or if you take the blood by syringe, put that blood into the test tube, put into the centrifuge machine. After centrifugation, you get this picture in the test tube. You will get this picture. This is magnified picture. These are the various components. Here you can see there the three columns: the upper column, the lower column, and the middle column. The upper column is composed of plasma. This column, the yellow or pale column, is plasma. The lower column is red blood cell, and in the center we have a ring, a bumpy ring. This ring is made of white blood cells. In these three columns, why the RBCs are in the bottom? Because the RBC contain iron, is heavy, so it settles down first, then the cells, and the remaining portion, which is a bit lighter than the cells, remain on the top, and this is the various composition of blood. Here you can see in plasma, which contain water, iron, protein, nutrient, hormone, and waste products. The lower column is RBC, which is red in color, and it is 45%. This is 55%, and the cell is 45%. Leukocyte, this ring is leukocyte. This is up to 1%. It is a bumpy coat. Sometimes it looks greenish. When it is green, it shows that it has even large number of neutrophils are accumulated in this ring. It looks blue or green in color. The blood consists of white blood cell and platelets, and also the plasma, in which all these three components are suspended. This is a vehicle for the movement of these components. Plasma is the liquid compound which contains soluble fibrinogen protein, and the protein, one protein which is called fibrinogen, which is actually a clotting factor. When this clotting factor is removed from the plasma, the remaining portion of plasma is called serum. When the plasma contains fibrinogen, it is called plasma, and when fibrinogen is removed from the plasma, then it is called serum. What are the constituents of plasma? It contains 91.5% water, protein are 7%, and they are albumin, globulins, fibrinogen, and other soluble 1.5%. Waste product is urea, uric acid, ammonia, and creatinine. Nutrients are glucose, amino acid, and fatty acids. These nutrients the blood receive from the gastrointestinal tract. It receives oxygen from the lungs, so the nutrient the blood receives from the gastrointestinal tract. And gases, these are the gases which are present in the blood, and also electrolytes, which are sodium, potassium, calcium, magnesium, chloride. Cellular composition of blood. The blood has red blood cell, white blood cell, and platelets. There are 5 types of WBC and platelets, and these are the red blood cells. So the white blood cell are 5 types. One is neutrophil, the other is eosinophil, the third one is the basophil, and lymphocyte and monocyte. We'll discuss it in detail, and also we have platelets and RBCs. There are two types of WBCs. One are granulocyte and the other is agranulocyte. The one type of cell contains granules and the other are free of granules. They have no granules, and these granulocytes are granular neutrophil 62%, acidophil or eosinophil 2.3%, and basophil 0.4%, and agranulocytes are 30%. They are lymphocytes are 30% and monocytes are 5.3%. The circulatory system of human contains about 5 liters of the most remarkable fluid on the earth. This blood flows through 65,000 miles, which is equal to 1 lake and 5,000 kilometers, round about 1 lake and 5,000 kilometers of blood vessel. And by this circulation, it carries oxygen and nutrient to 100 trillion cells of the body. At the same time, it removes the waste product from these cells. You know that metabolism is all the time in process in the cell, and due to this metabolism, waste products are produced. So these waste products are removed from this tissue by the blood. One of the waste product is the carbon dioxide, which is taken to the lung, and from there it is removed from the body by exhalation and when we breathe outside. So we exhale the carbon dioxide. Other waste products are carried to the liver or to the gastrointestinal tract or to the kidney, from where these waste products are removed from the body. The red blood cells, which make round trip to your big toe about every 20 seconds. It takes 20 seconds, the red blood cell, from heart to the big toe, and then from big toe to the heart it takes 20 seconds. Flow through capillary just 1/10 of the diameter of a human hair. The diameter of capillary is 10 times less than the human hair. So think about that. The RBC pass through these narrow diameters. As the size of RBC is greater than the size of the capillary, RBC has the capability to change its shape. Why it can change its shape, or why it changes shape? Because the content of RBC is less than the size of the RBC. When pressure is developed on the surface of RBC due to its flexible surface, it is prevented from rupturing. It doesn't rupture when it passes through narrow capillary. Remember, in normal condition, when there is abnormality, there is rupture of RBC. The example is like a balloon in your hands. When you press a balloon and you want to pass it a narrow hole, you can shrink the balloon and then you can pass through it a narrow tunnel or a narrow space. In the same way, the RBC also wrinkle and pass through the narrow tunnels. Blood is also vital to maintain a stable body temperature by varying the amount of blood to different area of the body. This is very comprehensive mechanism and controlled by the thalamus. To do all this, the heart pumps about 2,000 gallon, 9,100 liter of blood per day. Pump 91,000 liter of blood per day. Its valve separates some 5,000 times per hour and is never stopped for maintenance. Remember, every machine which is artificially made work for some time, then it needs repair work, and for repair we need to stop that machine, but the heart never stops. Even during the case of when it stops, it cause end of life. Throughout the life, the heart performs its work. The Bible said a long time ago that the life of the flesh is in the blood. Flesh means when you cut the blood supply to any organ, to any muscle, that muscle cannot survive. Like in case of myocardial infarction, when there is a blockage in the coronary artery, the blood supply to the heart is stopped and a person gets myocardial infarction. Or in case of stroke, when there is a stoppage of blood, a blockage of blood, or no supply of blood to the proximal portion of the brain, that area become die, and the area connected by the body area which is controlled by that part of the brain become paralyzed. This is the cycle by which the blood controls the body temperature. When the body gets warm, there is the signals are sent to the hypothalamus. It causes vasodilatation. There is diaphoresis or sweating or perspiration in the body. The body get cool. Again, it is a negative feedback mechanism. Signals are sent to the hypothalamus where the constriction occurs because shivering. Due to shivering, muscle get heat up and the body temperature is become retained. Some important terminologies regarding blood hematology. What we mean by the hematology? This is branch of science concerned with the study of blood forming tissue. Study of blood when we do tests in laboratory or when we examine its various components. Blood forming tissue where the blood is formed, like in the adult in bone marrow, and in fetal life, liver and spleen also take place in formation of blood, and disorder associated with them is called hematology. So study, formation and disorder, these all things are called hematology, and it's a Greek word. He means blood and logos means study. Hematopoiesis. Hematopoiesis is an active process which maintains normal number of circulatory blood cells and responds rapidly to increased demands such as bleeding or infection. When hematopoiesis means when all type of blood cells are produced at the same time. It means there's RBCs are produced, WBCs are produced, and platelets are produced. All 5 types of WBC, platelets and RBC. When all these cells are produced at the same time, this phenomena is known as hematopoiesis. Erythropoiesis, it is the production of red blood cell. Erythro means red. So the production of red blood cell is called erythropoiesis. In adult, red bone marrow of long bones have bone, breastbone and ribs. These are the bone in adult which are responsible for the production of RBC, and in children up to 5 years, bone marrow, all the bones in fetal liver and spleen is also responsible for the production of RBC. Fetal life, when still the baby is in the womb of a mother, he is not born. So the RBCs are produced by spleen and liver also. There is another terminology which is called polycythemia. When the RBCs number is increased, this condition is known as polycythemia, and this condition actually occur at high altitude because the red blood cells are responsible for the transportation of oxygen, and at high altitude the oxygen concentration in the air or environment is low. To accomplish this deficiency, the number of RBCs become increased. That's why athletes are trained on high altitude. They develop increased number of cells, and then they can perform at sea level, because at sea level the oxygen level is high and less. The number of RBCs are less than at high altitude. So when the wrestler take part in running, he has a greater capability of oxygen carrying capacity. Decrease in number of RBC is known as erythropenia. When there is decrease in the number of RBC, this is called erythropenia, and this is very common in nutritional deficiency, abnormality of the cell, nutritional deficiency, and common causes worm. When there is worm in the gastrointestinal tract, that take away the nutrients, especially the iron, and the person produce less RBCs. So whenever you get a result from laboratory which has less RBCs, so first think about worms and nutritional deficiencies. Leukopoiesis. When we define leukopoiesis, the process of development and maturation of white blood cells. Erythropoiesis, red blood cell, and the leukopoiesis means the production and maturation of white blood cell. It is also called leukocyte or leukopoiesis. RBCs, when you will look for RBC under the microscope, you will get this picture, and they look red. Why they look red? Because the red color of erythrocyte due to the heme group of hemoglobin. When heme is added globulin, so it gives its red color. The plasma is straw color alone, but the red blood cell change color due to state of hemoglobin. When combined with oxygen, the resulting oxyhemoglobin is scarlet or dark color. It combines, and when it loses its carbon dioxide, its color is blue. Erythrocytes in mammalian are enucleated. Mammalian means those who breed their babies milk. They are called mammalian, and the erythrocytes of all mammalians are enucleated. Enucleated means they contain no nucleus. When mature, remember in mature form, when it is under the process of synthesis, a remnant of nucleus is present, but when it is fully mature, it loses completely its nucleus. It also lost the DNA, and DNA is the master plan of cell development. The cell cannot reproduce. When there is no DNA, there is no production of RBC. In comparison, the erythrocyte of nearly all other vertebrates have nuclei. The only known exemption is salamander. The mammalian erythrocytes also lose their other organelles, including their mitochondria, and produce energy by fermentation. Mitochondria is the powerhouse of a cell. When it produces power, energy, the cell, when these organelles, mitochondria is an organelle, when it's lost, cell, the erythrocyte get its energy by fermentation, while and the process is glycolysis of the glucose followed by, so by this mechanism there is no mitochondria to provide energy for the cell, so by this mechanism the RBC gets its energy. Rolex formation. So in large blood vessels, red blood cells sometimes occur as a stack. What we mean by stack? Let's side next to the flat side. This is known as Rolex formation. The flat surface of RBC, of one RBC count pass to pass to the another RBC. Normally these cells repel each other. They don't attach or fuse with each other, they repel each other, but in some condition they come face to face and join each other at flat surfaces. It occurs more often if the level of certain serum protein are elevated, as for instance during inflammation. Inflammation is in condition when there is damage to tissue. And when damage to tissue occurs, proteins are produced. Among these proteins, there are some proteins which cause this Rolex formation. Rolex formation also occurs in the blood vessel when the flow of blood is slow, when the vessels are dilated, and in these dilated vessels blood flow is slow. It causes Rolex formation, such as it's called ESR. In ESR, the RBCs also cause Rolex formations. In varicose vein or in dilated vein in the leg, in vein there are veins, and it prevents the backflow of blood. When these veins are rearranged or non-functioning, the blood becomes flow in backward direction, or the flow becomes slow. Due to that stagnation, blood Rolex formation occurs. It also occurs in bedridden patients. Function of RBCs: it transport oxygen from lung to tissue and transport carbon dioxide from tissue to the lung. Normal blood contains 13 to 15 grams of hemoglobin per 100 ml of blood. When you take 100 ml of blood, you have 13 to 14 grams of hemoglobin. This is the upper limit of hemoglobin, and one RBC contains about 250 million molecules of hemoglobin. If you will take one RBC, the RBC contains hemoglobin and it is equal to 250 million molecules of hemoglobin, and each molecule of hemoglobin carry 4 molecules of oxygen. So you can assess, imagine that how much oxygen can be carried by RBC, one RBC. Now functions of RBC, it is just simple. The primary function of RBC is transport oxygen from the lung to all cells of the body, and RBC contain a protein called hemoglobin that actually carries oxygen. In the capillary, the oxygen is released to be used by the cell of the body, and 97% of oxygen that is carried by the blood from lung is carried by hemoglobin. Remember that 97% transport of oxygen is carried out by hemoglobin. The other 3% is dissolved in plasma. Hemoglobin also allows the blood to transport 30 to 100 times more oxygen than could be dissolved in the plasma. 30 to 100 times more oxygen can be carried by the hemoglobin than the plasma. Thank you. Hoping see you in the next lecture.